In this second presentation for Unit 3, we will look closer at plans administered by CMS. CMS, or Centers for Medicare and Medicaid Services, administers the public health plans including Medicare, Medicaid, and the CHIP program. We will look at each of these programs a bit more in depth throughout this presentation. Let's start with Medicare. Medicare is a federal plan that is administered at the federal level. Medicare has 4 different parts, A, B, C, and D. Part A is the traditional hospital insurance plan, which covers services deemed medically necessary to treat a disease or a condition. This includes hospital care, skilled nursing facility care, and nursing home care, unless that care is considered custodial, hospice, and home health services. Part A is considered the minimum essential coverage and meets the requirements set by law for people to have health coverage. To be eligible, one must be age 65 or older, have a disability, or have end-stage renal disease. Part A can be free, but it depends on the earnings of the patient as well as a complemented determination for quarters of coverage, which are earned through the payment of taxes through FICA, or the Federal Insurance Contribution Acts, during the years the patient worked. Part B is the medical insurance, which is a voluntary program that requires a monthly premium for coverage. Part B covers medically necessary services, such as those needed to treat a medical condition that meets the standards of medical practice, as well as preventative services such as vaccines and other treatments to prevent illness. As long as the provider accepts Medicare assignments, preventative services are usually at no cost to the patient. There are certain things that are not covered by Parts A and B, including long-term or custodial care, dental care, eye exams and glasses, dentures, cosmetic surgeries, acupuncture, hearing aids, and routine foot care. Another option for patients is to choose a Medicare Advantage plan, also known as Part C. Part C includes both hospital and medical insurances, or Parts A and B, and is provided by private insurance companies that are approved by Medicare. Part C does require the patient to pay out of pocket to obtain the coverage, and then may require additional out-of-pocket expenses if the care is not in-network. Part D is the Medicare prescription drug plan, and regardless of what coverage the patient has, Part D is an additional expense through a monthly premium, as these plans are administered by private companies approved by Medicare. One last note on these coverage levels. If a patient chooses original Medicare with no supplemental plan, often they can purchase something called a Medigap policy that covers costs such as copayments, coinsurance, and deductibles. Medicaid is administered at the state level in accordance to federal requirements and is funded jointly by states and the federal government. To be eligible for Medicaid coverage, the Modified Adjusted Gross Income, or MAGI, is used. The MAGI takes into account income standards as compared to the federal poverty level to determine eligibility. The demographics usually covered by Medicaid include low-income families, qualified pregnant women, those receiving supplemental security income, and children, which we will look further into on the next slide. Medicaid is the largest single source of health coverage in the U.S., covering 72.5 million people. Medicaid is accepted by hospitals participating under CMS rules and can also be accepted by private physicians and healthcare corporations, depending on the state plans offered and accepted. Each state Medicaid agency maintains an updated list of the providers in the area that accept Medicaid, so it's a bit different from Medicare in that respect. The Children's Health Insurance Program, or CHIP, is also administered by Medicaid at the state level. The program provides insurance for children up to the age of 19 when their family's income is too high to qualify for Medicaid. Each state has the ability to set income eligibility standards for their program, so this program really is state by state depending on the income and the federal poverty level. On average, family incomes up to $48,600 annually for a family of 4 qualify for Medicaid or CHIP. Children who age out after the age of 19 can be covered under Medicaid until they are 26. Coverage is renewed annually, and any parent, grandparent, or guardian can apply on the behalf of the child. The program covers all routine checkups, immunizations, doctor's visits, prescriptions, dental and vision care, hospital care, both inpatient and outpatient, lab and x-ray services, and certain emergency services. As with Medicaid, physicians can choose to accept the CHIP coverage. The last program to look at is actually not a public health care insurance, but is an insurance option for people who have been laid off or lost their job. The COBRA plan, or the Consolidated Omnibus Budget Reconciliation Act, allows workers to have the right to continue with their health benefits when a job loss or benefit change occurs, but the Act is limited in time and requires the individual to not only pay their original amount each month, but to also pay what the employer was paying, so the individual is paying the entire premium each month. So we have seen the main public health plans that are available based upon federal and state laws and regulations. These plans are important to any regulatory environment in healthcare to ensure that we are meeting the expectations laid out by the government when it comes to the public health plans. Most private insurance companies model their reimbursement method to that of Medicare and Medicaid, and additionally, to receive federal and state funds, hospitals and organizations have to apply and accept these insurance plans. We have seen the basics of each plan, as well as how eligibility is determined. These plans will continue to be important as we delve more and more into regulations and compliance.